see that it has 10 laser diodes on it, as you've seen. You're going to have 6 that cover the abdomen area. Then you'll have 2 on the side, which will be covering the flank area and also the hips. And as we maneuver this system up and down the table, we can apply it to different areas as the outer thighs itself here, and then also the arms and the back area, and also going to show you placement for underneath the chin or the neck area. So when we're doing this, the standardized area that you're going to, most of the treatments that you're going to administer in the office is just going to be the midsection here. So when aligning the system, this is the easiest part about it, is just lining it up. It's very simplistic, as you can see, and I can hear you messing with the system, Dr. Mahmoud. It's got a motorized arm. So what we want to do is with the patient, and in most settings, the patient's going to be here with as least clothes as possible. So it's going to be in a bathing suit or undergarments. But for this setting, the patient's going to wear the clothes, but it's going to be the same type of setup. So the machine itself is quite heavy, but it maneuvers on wheels. So what we're going to do is just going to minister it over the patient directly, just like so. We did discuss the glasses, Dr. Farhan, earlier. FDA doesn't require it, but in any case, we always recommend the patient to wear them, just because we don't know if the patient's going to decide they want to slide down or sit under it. If there's any indication of anything that happens, obviously as the medical practitioner, you're liable. So we always suggest that the patient wears the protective eyewear. So what I'll do is I'll first maneuver the laser over the patient like so, and I'll just lock it in. It moves quite easy, so want to always make sure you lock it in so it does not move out of its way, or the patient decides to bump it, then it's off center, then they start losing some of the inner density, so always make sure to lock it in first. And then you have the motorized arm here, which has a switch, and let me just go ahead and zoom in here. How's the video feed? I didn't even ask that. Does it look okay? Is everything coming through clearly?
Yeah, it's great.
Okay. All right, so all you have to do is just press this motorized switch down position, just like so, and it will lower down over the patient.
How do you get the arms to open up on the sides there, I see?
Okay, great question. So I'm going to zoom in here. You have this locking mechanism here. It's kind of like a handle. You just turn it to the left like this. It's going to unlock, almost twist out, and then the arms will fall. So once you turn it to the left, then you can pull it up like so and reposition it. So as you need to move it in, then you just turn it to the right and tighten it down like so.
Got it.
And then we'll lock it in position. So when you're aligning, are you seeing that there?
Yep, I got it. I got it to work on my end too.
Okay, fantastic. So when we're aligning it up, there's couple properties we have to always focus on. One is when you lower it down over the patient, what you want to make sure to do is there's a certain distance. You want to be within 5 inches. You can be as close as you want, but you want to be within 5 inches of the patient for maximum energy density. So when you're lowering it down and you set it up, you should have received in your package a tape measure, like so, just like this. Extends out and will wrap around. This is used for measuring your patients. So you might have something similar or a tape measure in your office already, but we include this for measuring. So when I'm aligning the system, what I make sure to do is take my tape measure, and when I'm bringing it down, you want to make sure you're within that 5 inches. So when I look over here at the patient, so I'm right about 3 inches off her body. So I'm within the area of where I need to administer the treatment. And then same thing what I'll do on the side here is when I bring it in, and what you want to try to do is make sure that those beams are directed right at the largest point of the patient. So whether it's going to be the flanks or the hips or the arms, make sure that all the energy is directed down on that. So what you would do is just loosen the arms up, bring it in as close as need be. But you also don't want to be too close sometimes because you want to have maximum coverage as the laser diodes turn on the patient, so you have a maximum treatment area. So what I'll do for this patient, she's a little bit smaller, so we'll go ahead and bring the arms in a little bit. So as we tighten so, then I just come back with my tape measure here and just make sure I'm within distance, which I am. So if I have to, and if I feel like I'm too close, what I can do is I can always just come back, pull it up, and raise it up just a little bit. That way I get a little bit more coverage on the treatment. So once you've done that, the patient's ready to be treated. So make sure they have their protective eyewear on, and then all you have to do from there, just come in here to your touch screen, hit the start button, and the treatment's being illuminated. So let me go ahead and turn off the lights here. That way you can see it, which you might. Okay, so you can see the amount of coverage that you have with the 6 laser diodes in the center. You have it from the top of the abdomen all the way to the down portion of it, and then on the sides here, if you can see that, you can see it from the flank area and even getting part of the upper hip area as well. And that's how you would align it. And the patient will just lie here comfortably for 15 minutes, and then when they're done with the front half, we'll turn over and do the back half of the treatment. Very simple, very easy to apply. Like I said, this will be the easiest portion of everything, is just aligning the system. So let me zoom out here a little bit. Okay, I'm going to pause the system. So when they're done with the 15 minutes, the machine will beep and it'll tell the patient to turn over. So then what we'll do from here, we'll just raise it up. Okay, we'll have the patient flip over into the front side. All right, and you might have to, and you'll probably have to adjust the placement just a little bit, and I'm just going to show you as I come directly down, you can see as the top laser diodes here are focusing on our lower back and then more on her glute area. So what we want to do then is just unlock the system and slide it a little bit up to focus more on the lower and mid back area like so. So we're having an even treatment. So what I'll do is just align it there. Lock it back into place like so. Okay, I'm locked in and stable. All right, then come back, readjust. All right, down all the way. Then I'll just check my diode distance. Okay, and within my 5 inches, and then I can readjust the sides here to make sure I'm directly everything in the area that it needs to be, just like so. Okay, and then resume treatment. Okay, now that I've done that, then she can continue with her treatments like so, and then we can treat the second half of the body or back side of the body. As you can see here, the laser should be aligning up from the mid-back area all the way down to the lower back area, and then you can see again covering the flank area. So you can see the large surface area that I'm going to be covering and treating on this patient. So that's how most of the treatments are going to go when patients come into your body. That's going to be the #1 requested area, because obviously that's where we hold most of our weight is going to be, and that's the last spot we usually lose it, is in our midsection. So when they're lying face down like this, you can give them the option to keep wearing the glasses or not, depending on what type of table you have. If you have more of a massage table type and they can put their face in it, then obviously wearing the glasses is going to be very uncomfortable and almost impossible for them to do, so you can have that as an option. So that's going to be the standardized treatment form right there. All right, so now I'm going to move on to treat the upper body and other areas. Any questions on that, gentlemen?
Not yet.
Okay, it's pretty simplistic like that. Okay. All right, so what I'll do is I'm going to go ahead, extend the arms out, unlock the treatment. Okay, so one thing I wanted to address too as well is you're going to have patients that are not going to obviously want just the midsection done, okay? Specifically women. Women more and more so are wanting their arms done and the bra line area a lot. We get a ton of that requested down here in Florida, obviously, because you can go to the beach almost year round. So the bra line and the arms area are heavily requested. So if you're going to treat that area, what we're going to do is make sure that we align it correctly. But if a patient wants multiple areas treated, midsection, and they want to do the upper body, that's going to be 2 different types of sessions. And you do not want to do them at the same time simultaneously. You want them to finish one area at a time and not to deviate from that. So you would not want to treat, say, the front side of the belly area or midsection and then do the back side for 15 minutes. So you wouldn't do 15 here and 15 there. It will not accumulate the results that you want. So whatever the treatment protocol is that we place and set in place, you want to make sure that you stick to that and do not variate it, or you won't have good results. See it all the time in training throughout the years. Do not variate the treatments from what we designate. And it'll be in your guide, and your trainer will go over those with you again as well. So if we're going to treat the upper body on the patient, so if a female patient comes in, she wants her bra line, her back, and her arms done, we'll go ahead and raise it up, and we're just going to go ahead and start with her face down, and we're going to treat the upper back and bra line area and the arms. So what we'll have them do is lay face down, and we'll have them put their arms down by their side. Okay. And this is where you'll have to address the side arms quite a bit, which will be more in the up position. So I'll go ahead and take the system, make sure I'm centered directly over the patient, like so. Lock it in. Okay, then let's go ahead and lower it down. Okay, I'm within my proper distance, as I can see there, but I'll still go back and check. And then what we're going to do here is we're going to adjust these side arms to make sure we're directing them on the back of the arms or the tricep area. So we'll just loosen this up, bring them down a little bit closer. And you might have to make slight adjustments to this after you turn the machine on. You want to make as many adjustments before turning the machine on so you don't lose any time or energy. You don't want to turn the machine on first and then start adjusting and moving it up and down, because then one, you're going to have beams reflecting all over, and plus you're going to be losing some of the energy and you're going to lose time on the results. And time is valuable with the treatment. So you can adjust their arm a little bit, bring it down, adjust it. Okay. In my position here, so let me just double check my distance. All right, just within 5 inches, I'm good. Now I'm ready to start the treatment. Go ahead and zoom in for you guys right there so you can see a good view of how to place that. And I am recording this, so I will send this to you. That way, if you need staff members or anyone to review it, they can certainly watch this. Okay, so as you can see there with the laser diodes, let me dim the lights. Okay, as you can see with the laser diodes, I've got her entire upper back here, all the way down to her mid back here, and even getting some of her lower back. And then as you can see the lasers here hitting the back of her tricep area. Actually, let me lower the camera a little bit. Okay, so you can see both laser diodes are hitting the back of her tricep from her elbow all the way up to her shoulder. So we're covering that entire area. So again, as I mentioned before, same as the lower half or the mid part of the body, she's going to lie here for 15 minutes, finishing this session. And then what we're going to do is when she's done, we're going to turn her over and finish the front part of the arms. Now, this is where you're going to want to adjust the laser a bit. So let me zoom out so you can go ahead and see that. All right, I'm going to go ahead and raise it up and have our patient turn over. Okay, so on this side here, this is where we're going to want to adjust it now, because the first concern, as I'm sure you already know, if you're going to lower it down and laser it, is what about the chest area? Typically, most women do not want to lose anything in the chest area, and for us men, we typically don't want you to lose it in that area. So what we're going to do is we're going to go to our screen here. If you look to the right side of this, and Dr. Mahmoud, you were probably, since you're in front of the machine, you're the one that's going to be able to see this, but it'll be in the diagram, and Dr. Farhan, when you see it, you'll be able to see what I'm discussing here. But you'll see on the right side, it says laser heads, and below, in the center, we'll have L1, L2, L3, R1, R2, R3. Okay, that's going to discuss the lasers from this side down that are in the center. So since we're going to be treating the arms on the front side and we don't want anything to come on or illuminate on the chest area, we'll go ahead and turn those off. And all you have to do is just press those icons. They're going to go from green to white. And if you're in front of it, you can go ahead and press those. And as you can see, you're going to be turning those off. So that way when we come over here, and now that those are turned off, the only lasers that are going to illuminate are going to be the ones here on the side. So I'm just going to adjust those really quick. Just like so. This one just like that. All right, I'm going to go ahead and resume treatment, and let me turn it on so you can take a look. Okay, as you can see there, as we are only treating now the arms and the entire midsection has been turned off. If you so desired and you still wanted to treat some of the midsection area, let me zoom out just a little bit. Not sure that you can see this, but on these lower diodes right here, they're not covering the chest area. They're covering just the upper abs. So if you wanted to come back and just decided you wanted to turn those on, you certainly could do that mid-treatment. As I did so there, I turned those on. That way I can get a little bit more treatment on the ab area. But did you get a chance to see that, Dr. Mahmoud, and see where you can turn those on and off? Okay, I'll take that as a yes.
I'm sorry, say that again?
I was just making sure. Did you see on the screen where you could turn those on and off?
Yes. Yeah, it worked out fine. I noticed that you can't press it too hard. You have to give it a very light touch.
Yeah, with all of it, and that's something I want to address too, is you'll be working through the touch screens. All the new touchscreen software we get now, the harder you press, the harder it is. You have to press really, really light for it to actually ignite, which I'm still trying to figure out that concept. But they're super sensitive, so you're absolutely right. The lighter you actually touch on the screen, the better they activate them. Okay, so that's how you would place it on the upper body. Obviously, if it's a male patient and he would like to treat that area, you can keep those on, and we can certainly treat that area and cause a reduction in fat to that area. So that gives you two options. Now, the next option I'm going to show you is now that we're going to treat the neck area. So this again is where you're going to work on the option of turning diodes on and off. So let me raise this back up. Okay. All right, so if we're going to go ahead and treat the neck area, let's unlock that. We'll go ahead and hover the laser right over the face, like so. Okay, I'm going to go ahead and lock in. And then for doing the neck area, we're only going to turn on 4 laser diodes total. We're going to turn on one that will cover each side of the deck, and then 2 here on the center are going to cover just underneath the chin area. So we're only going to need a total of 4 laser diodes for this. So what I'm going to do now is just lower it down over the patient. And yes, this is definitely where you want you want the patient to wear the protective eyewear. All right, so we'll bring it in, lock it in place. Okay, so for this treatment, as you're looking at the screen in the laser heads, the ones that you're going to keep on are going to be L4, L1, R1, and R4. So if you're looking at the screen there, Dr. Mahmoud, that would be the ones that you're going to be turning on. So what I'm going to do here.
So just that first row, L4, L1, R1, R4.
Yep, across that first row, exactly. And then let me go ahead and turn off the light so you can see it better here. Okay, try to zoom this in a little bit more. Okay, so as you can see there, the amount of coverage you can see from this patient is we're doing everything underneath the chin, and it's kind of coming across their ear, which is not going to cause, and that's another great thing with the treatment. Since these are non-thermal semiconductor laser diodes with a photochemical response, there's no overstimulation problem. There's no stimulating too long where you cause any destruction to the cells or apoptosis or damage to the tissue. There's no overstimulation or anything been proven since I've been with the company as far as ill effects. So there's the safety parameters, but I'm going to zoom in just a little bit more so you can see it. So that's how the treatment should look. So you're treating completely underneath and engulfing the chin. And on this is going to vary now when I talk about treatments on this. So this is the only time where if a patient wants to treat underneath the chin, they're only going to need 15 minutes, unless in patients that are heavier and more obese, if they have it on the back of their neck to where the skin starts rolling up and they're a lot heavier set, then I would recommend doing the back side of the patient as well. But other than that, most of your patients coming in will just need the front side done for 15 minutes. All right, any questions on that? Pretty simplistic. All right, so now that we've done the midsection, the upper body, the neck area, then next would just be the lower body. So let me just adjust these arms, open them up a little bit, and then we'll slide it on down. Okay. Raise it up and unlock the system. Okay, so for those patients, and most of them are going to be, almost all of them are going to be female patients because just as, all us men, most of us don't carry the excess fat or weight in our thighs. Typically for us, it's going to be our midsection and our love handles. So the female patients that just want to come in and just have their thighs done, well, we certainly can accommodate them. So let me adjust the camera. I do apologize for you a little bit. Let me back up and move it over for you. Okay, all right, so if we're just going to do just the thigh area here. All right, we're going to do, again, both sides of it. 6 laser diodes here that are center, directly down the inner part of the thigh. So we're going to take it, line it down here so. And in most patients, you should be able to cover from the lower quadriceps all the way up to the top and maybe even part of the hip area. So what we'll do is we'll align it down like so. I'll come back, lock it in. Maybe check, readjust, make sure I'm okay. And then you can always make sure the patients too, if you have to adjust it to make sure you're hitting the direct area, whether they need to put their legs in or out, please suggest them to do so. And then we're going to come in, again, bringing in the outer laser diodes, adjusting those like so, tighten down, and making sure I'm within my distance here. All right. Okay, within my 5 inches, so I'm good to go. So since I turned the other ones off before, I'll have to come back and turn everything back on. And then let's resume treatment. So zoom in, and let me turn the lights down again for you. All right, that's how the alignment should look. As you can see there in the image, I have the 3 laser diodes on each inner thigh coming down here. Then you have the 2 on the exterior portion. So that will help treat the entire lower half of the body for those patients that just want their thighs done and their lower hip area. So we treat like this, again, 15 minutes on the front, and then we turn over, and then we'll do 15 minutes on the back side as well. Now here's another instance where if you have patients that don't want to lose the backside, whether because they spend all that time in the gym or they had a Brazilian butt lift, whatever the case is, this is the case where we would turn off the laser diodes in the middle. So we'll have our patient turn over, and we'll finish the second half of the treatment. Again, might have to make small adjustments here. Okay. And whether it's you, two gentlemen, as a doctor, or it's going to be your assistant, I'm going through this quite quickly because it's easy and I've done it before. It's okay for them to take extra time to make sure everything is aligned correctly, to make sure everything's centered, going directly down. You're not getting any turning or reflection to where you see the lasers bouncing off the wall. It is better for the treatment for all the energy to be located directly down on the patient. So spending the extra time to go through these exercises and making sure it's perfect, I do encourage. So spending a little extra time doing it. All right, so we're going to go ahead and lower it down like so. All right, so now in this, we're going to take it and finish the second half and bring it in, just like we did on the front half. All right. And then what we're going to do is we're going to have to turn off some of the laser diodes. So for this portion of how I have the machine set up, I'm going to have to come through and turn off L3 and R3. And then you'll have to take a look at it, and depending on the patient and how close you are to the glute or butt area, you can even turn off L2 and R2. So as I resume my treatment here, I turned off those. Let me turn off the lights just a bit. Okay, now as you can see, they're receiving the second half of their treatment. So in this case, I got two on the outer portion still, but I only have one on each side of the inner thigh because we don't want to laser any of the glute or buttocks area. So you can determine that as the patient comes in. Still going to have great results, still going to have great emulsification in the thigh area because we treated the front and now we're doing the back. Any questions with that, gentlemen?
No.
It's straightforward.
Okay. Yeah, it's very simplistic to this approach. All right, so I'm going to go ahead and raise it up. All right, let me turn back on the lights. Okay, then when they're all said and done, just take it, move it out of the way of the patient. And the thing is, when the treatment completes and they are done with their 30 minutes of treatment, the arm will automatically raise up to its top point so you can remove it from off the